So next, I'd like to call up Dr. Bill McDonnell, and before I do, as I mentioned, he is the medical director for medical policy at Blue Cross and Blue Shield. I want to say thank you to Blue Cross and Blue Shield for all your help and effort through this. One of the things that we have been really wanting people to adopt was telemedicine. This is something that doctors want to do, that patients want to do, and they want to be able to do this so that they can, again, limit the spread of that virus, make sure we're keeping everybody healthy and safe. And Blue Cross Blue Shield has stepped up to become the first company here in Nebraska who is going to reimburse those regular doctor visits for telehealth rate. So if you're going to do a telemedicine type appointment, you'll get reimbursed the same rate as if the person came into your office. That's exactly the kind of things we want to see here in the state. That is what we call leadership in a time of emergency. And I just can't thank Blue Cross and Blue Shield enough for stepping up and being the first company to do this. We really appreciate that. So, Dr. McDonnell, if you could come up and talk a little bit more about that. We're really grateful for your efforts here during this emergency to step up and really do what you can do to help make sure you're keeping Nebraskans safe.
Well, thank you very much, Governor Ricketts. Thank you both for your kind words and for the opportunity to speak to everyone for a few minutes today. You know, at Blue Cross and Blue Shield, we feel that our most important mission right now is to protect the health and the safety of our members. We also know that we cannot protect the health and the safety of our members unless we give our doctors and our other healthcare providers the tools to do so. You know, as the governor mentioned just a few minutes ago, our usual ways of doing business are not enough right now during this pandemic. And so because of that, we are proud to announce our new policy for telehealth. As the governor described, this is one of the most proactive and progressive telehealth policies in the country. Essentially, our telehealth policy will reimburse doctors and other healthcare providers the same for telehealth as they would for any kind of office visit. Follows the same rules. In addition, unlike usual office visits, there will not be co-pays to the patients. There will not be the cost sharing that you normally have. We really want to be quite aggressive with this policy. The benefits of this policy are going to be better access to the patients to their doctors. It's going to allow their doctors to provide care safely. And another benefit is going to be that we will be making payments that will help ensure that our doctors and that our other healthcare providers can keep their doors open and can stay in business during this pandemic. We want to thank the governor for his strong leadership during this crisis. Governor, your calls for social distancing and for self-isolation when indicated, those things are saving lives right now. And we feel that our new telehealth policy will fit very neatly into your plan. If we all practice good social distancing, if we all practice social isolation when it's indicated, and if we use telehealth when it's indicated, we're going to weather this storm. Thank you again.
Well, again, Dr. McDonnell, thank you so much on behalf of the state of Nebraska to Blue Cross and Blue Shield for this great leadership decision you've made. We really appreciate it. And I hope the other insurance companies in the state of Nebraska will follow suit and do the same to make sure that we can really offer the telehealth option to our patients here in Nebraska and to our doctors and make sure that we can all get through this storm, as you said, safely and in a healthy way. So thank you so much. We really appreciate it.